Welcome to growthtofreedom.com, the show that brings you inspiration, transformation, and leadership. We're helping you connect the dots, see the blind spots, and get unstuck so you can go out and create more sales, more growth, more profits. More importantly, so you can have a bigger impact, a bigger reach, make a bigger difference, a bigger contribution. Let me ask you, how much do you think you're wasting in your business with the high cost of healthcare? And what if there was a better way to actually go out there and fight healthcare so that you could make healthcare an advantage in your business, that it could cost you 20, 30, even as much as 50%, 60% and more less than it does today? Or what if you could actually turn healthcare into a profit model and a profit center in your business? How excited would you be? How would that shift the game for you? How would that shift your mindset about running your business? Well, today's guest expert is uniquely qualified to talk on this topic. In fact, he's built an entire, suite of businesses helping hundreds and thousands of business owners like you all over the country. And in their businesses, get this, they give all their employees free healthcare. But he doesn't stop there. Not only does he give his employees free healthcare, he gives virtually all of their family members free healthcare too. And he'll tell you, and he's going to tell you how he's been able to do this, how it's turned into a profit center. He's the president and co-founder of Redirect Health, a company that uses unique healthcare strategies to help businesses and business owners, founders, CEOs, just like you, to be able to attract and keep employees that they need, that you probably want, right? You want those high productive people, right? Redirect Health is a solution that's useful when traditional insurance and deductibles are just way over the top. Have you found that to be true too? Have you found it to be a nuisance for you and your team? David Berg, Dr. David Berg, is a finalist for 3 Best-in-Class awards. The 2018 World Healthcare Congress in Washington, D.C. is the winner of the Phoenix Business Journal 2017 Healthcare Innovator Award, and is the author, multiple best-selling author of the Business Owner's Guide to Fighting Healthcare. David, how are you?
Good morning, Dan.
Good morning. It's great to have you with us.
It is great to be here.
Awesome. Well, I want to dive right into it, David. I mean, you have such a fascinating, we got a chance, first of all, we'll thank Joe Polish, because without Joe, we wouldn't have gotten a chance to meet through Genius Network, doing Genius Networking. And I remember when you first presented at Joe's event in one of his offices initially, talking about healthcare and how you're revolutionizing healthcare, first at home in your own businesses, but then for others, and kind of got to see this expand. You're now in 50 states, just changing people's lives. Before we get into some of this transformational strategy you've built, let's go back. Like, why are you on this mission, on this journey to transform healthcare?
Well, a lot of people think that healthcare is the driver of it. I really like business. I like business, and I happen to be really good at healthcare. So why wouldn't I use healthcare to make my business better and give me a business advantage? I think if I was in the car wash business, I'd be figuring out how to do the same thing with car washes. I don't know, but I really have learned how to maneuver around the healthcare system, and we're really good at it. We've got incredible processes in place, and we've got we've done a lot of strategic thinking around it that gives us huge advantages that others don't have and aren't thinking about. So that just happens to be how we chose to help our business and give ourselves a business advantage. And it worked so well that I started helping some of my friends' businesses, and it worked in probably about 12 to 15 of theirs. And next thing you know, all my friends were taking up all my time helping them with their healthcare solutions, that I turned it into a business in about 2013. So I could actually start charging my friends. Now, you think any of my friends would go in their pockets and pay me? Nope. So I had to turn it to a real business, and we did. And now you're right. We're in all 50 states. We have probably about 1,000 small business clients. Some are getting pretty large now. Lots of them on the horizon right now that we're talking to, in big associations. But it's just a common principle that's makes sense to everybody. Let's eliminate the unnecessary spending in healthcare that's taking away our business advantage and making it impossible to afford to buy what we need or provide what we need for people that make normal wages. $15 an hour is $20 an hour, $12 an hour. Those are normal wages. Those aren't low wages. 51% of American workers make $15 an hour. Those are normal wages. So we've got to make the math work. And the best way I know to make the math work is to eliminate the unnecessary spending in healthcare. Just eliminate.
And speaking of eliminating waste, as I've gotten a chance to know you a bit, right, over the last handful of years, like as I view you, you're like one of the most efficient people that I've ever met at looking at things unique. We were kind of talking about it before the show. A lot of people look at, okay, what's the one domino here that I can tip over that'll knock down 1,000, or one hinge that gives me exponential growth. But you look at it, one way you look at it, it seems, is the opposite of that, is like, what's the one domino if I take away, it just solves all kinds of problems, right? It eliminates a lot of the big issues. Or, if you're watching right now, or you're listening, maybe you've seen the movie The Founder about Ray Kroc. And there's a scene in the movie where he's on the parking lot and he's kind of walking through the process of efficiency and effectiveness. And, it's like this whole idea of do things right, do the right things. And he was a mad scientist like this. Well, as I envision you, David, to a degree, like I envision you that just naturally you can find the holes, find the gaps, remove the domino that's causing like these big blocks and big waste. You pull them out. Now the company, not just by one domino, is not just more efficient, but they're exponentially more efficient. Talk to like where did this come from? How is it that you view the world this way compared to others? I'm curious.
Just a little bit of a funny story. It goes back when I was 19. I got caught sleeping on my my mother-in-law to be's couch, and being lazy. And she said she always saw me lying down, and I was so lazy, and I couldn't hold my tongue. And I said, Gloria, I love her to death. I'm going to get in trouble if she sees this. I said, Gloria, to the untrained eye, it's hard to see the difference between laziness and massive efficiency. And, it didn't go over really well, but I think that's where I started. Like I just started thinking about it, and I had to double down and prove I was efficient, not lazy, from my college years. And but I think there's a connection between the two, right? There's an element of it's not that I'm lazy, but I'm lazy about doing things that don't need to be done. And everybody does things, including me, every day, things that don't need to be done. I don't tolerate it as well as maybe somebody else. It's irritating, annoying to me. And I've had coaching from Dan Sullivan for 20 years now. So one of his things is identify the irritating, annoying things and figure out a way to eliminate them. So it resonated with me for a long time. So let me give an example in my world. So we've done well over 3 million doctor's visits, surgeries, here in Phoenix, in all our 5 centers and surgery centers. So I know the delivery of healthcare pretty well after 3 million of those. And some are virtual, some are in office. The majority are in office. More and more are going virtual now. So I really understand the moving parts to that. What slows it up, what speeds it up, what's necessary, what isn't, what creates value, what doesn't create value at a very nuanced level. And I like that nuanced level. I like engineering the process. And so one of the things that irritates and annoys everybody is to you speaking about dominoes, is copays,
right?
Deductibles. Like there isn't a purchaser or user that appreciates a copay.
Right.
That appreciates a copay. Like, so we ask the question, why does it even exist? So I have dissected the healthcare delivery process into hundreds and hundreds of parts. But in those parts, there are dominoes, and the copay is one of those dominoes, meaning that, and not a domino, if I add something, it knocks everything down. It's like, if I take it away, what else goes with it? What else just gets sucked away with that domino? So this just, I could list 30 of them for you, but let's just pick copays, because everybody knows what a copay is, that $10, $25, $50 charge you pay your doctor when you go. But if we get rid of the copay, meaning it's $0, what else went with it? Do you need a cash drawer anymore? Do you need checks? Do you need a merchant account for the credit card, the merchant account to take credit cards? Do you need those? They all go away. They go away. Well, do you even need to send a statement out if the bill is $0? No. And there's these things called explanation of benefits your insurance company sends you, that tells you this is not a bill, but it sure looks like one, and it confuses everybody.
Right.
Right, but even before that went out, somebody had to process that in a computer. Somebody had to fold it and put it in an envelope and lick the stamp. Well, that goes away. If the EOB goes away because the copay went away, all that stuff goes away. And the billing department goes away. The customer service, when you don't understand your EOB or your statement, you call me, I got to pay somebody to answer the phone and say, hey, Dan, don't worry about it. Here's what it means. Those are all expense. Those are all expenses that limit that create no value for you as the user and no value for the purchaser if that's your employer. So the copays and deductibles and all the administration that was attached to it and billing and it all went away. And probably that represents about 40% of the costs in healthcare right there for the type of healthcare I do. I'm not talking about brain surgeries and major surgeries. I'm talking about the routine, everyday care that people need, their primary care, their chiropractors, their labs, their annual physicals. You get rid of the copays and deductibles and the administration that goes with it, and the coding and the computer systems, and the people have to process it, and the oversight, and the stamps that need to be licked, and the people have to answer the phones to explain it. You easily get rid of 40% of the cost with that one move. So we did that.
Well, think about that. As you're listening or watching right now, what would it be worth to eliminate 40% of those costs and then have that passed down to your company's bottom line, to your employees' bottom line? How does that change the game and give them greater certainty, keep more money in their pocket, keep them where they're not freaking out? I mean, like one of the common reasons people go bankrupt today is because of exponential healthcare costs, medical emergencies. But what if you could help be a relief source for something like that? Now, David, you have a fascinating look at healthcare, and I think you call it everyday healthcare and then the other type of healthcare. Speak to that a little bit and how you have created these couple buckets and how it creates even more efficiency in the process.
Gotcha. So usually what happens in America, now I grew up in Canada, so it's different there. So when I moved here 25 years ago, like I had to figure it out. And so I looked at it to study it, to figure it out. And there were a lot of things that didn't make sense. And, but you just had to take it, but it was irritating, it was annoying. It didn't make sense. It made the math not work even. And it was quite confusing to me that people would tolerate it. And it was perplexing because I just assumed America was better. That's why I was coming here.
Right.
So it didn't make sense to me. But one of the things that didn't make sense to me is how these large insurance companies, and now it's hospitals and insurance companies are working together, how they would control the rules and the data and the expenses and the services around all these really low cost things that happen very frequently, but then they would put barriers in the way that make it harder to get them and create costs in double, triple, quadruple, 10x the cost on these very frequent things. Also, they can control, it seemed like, so they can control the funneling into the more expensive things. So that seemed like an obvious problem for me, that there was unnecessary irritation and annoyance and complexity being added to the system that I had to participate in. So I'm a big fan of mental modeling and thinking about my thinking before I actually do it. So a lot of times I'll say I did something, I really just thought it 100 times. Or I thought about different variables 100 times. And it's not always clear what I did and what I've just thought through. But I modeled out, like, what would it look like if the insurance companies and the hospitals and the drug companies, they only participated in that expensive stuff, catastrophically expensive stuff that happened very rarely. What if that's all they participated in? How does that change the dynamics of it?
Right.
What if they didn't participate in the rules of the first 90%. The first 99%. What if they didn't even get the data for it? What if they didn't set rules? What if they didn't even sell it? That was the thought. And I first applied to my own business. And what I noticed as soon as I did that one move, I lost 30% of the cost, which gave me a huge business advantage. That was back 2008. And so today we separate it. The first separation is so important, and I can never see myself violating this one. We call it everyday care. All the stuff that people have, the primary care, the chiropractic, the navigation through this, and we've added services with all the money we freed up. We add new services, including all the virtual stuff that's common today that wasn't so much 10, 11 years ago. But the ability to proactively and efficiently communicate back and forth So it's not an encounter, it's a relationship in the everyday care bucket, and totally separate it from the hospital and catastrophic bucket, if you will. Those are important things, but we're not going to let them be at the center of them because they happen so rarely.
Right.
They do happen rarely. They need a different set of skills, right? So when something's happening all the time, the main set of skills and the optimization needs to be towards speed and responsiveness and easy and affordable, right? That's the optimization of the everyday care. The first 90, call it 95, maybe 99% of it. It's
Right.
only the last little bit where we want to optimize for, hey, let's be perfect here because we're doing brain surgery, or we're doing a heart surgery, or we got an appendix needs to come out, or there's a baby coming out, right? Let's be really, really diligent about being perfect in this small percentage of the time, so we can be more perfect, so we can be more on top of things, attention to the detail. And let's slow the world down and make sure we're making the right decisions. But over here, let's speed the world up. Let's make it easy to get you're wondering about that rash. Let's make it so you can get it taken care of right now and close the loop. Let's not make you make an appointment and have an appointment 3 weeks later, which is the average time it takes to see a primary care doctor in America today. And then when you go there, you gotta wait a half an hour for your appointment. And then when you go in there, you gotta wait 10 minutes, waiting for the doctors and come in for 5 minutes to say, hey, here, yeah, just put cortisone cream on it. That's what we
Right.
like, come on now. Let's just close the loop the moment you have the thought. And let's do it really inexpensive. Let's eliminate the need for that brick and mortar visit. Let's eliminate the need for somebody to take your scheduling call. Let's eliminate the need for somebody to take your copay. Eliminate the need for somebody to send in the claim to your insurance company. Let's eliminate the need for you to get an EOB, explanation of benefit, and eliminate the need for you to call somebody, and eliminate the need for that somebody to pay that person to take your call. Let's just eliminate those things by being smart up front.
Smart up front. And you're getting a perspective to see how his smart up front can help you. You're getting a glimpse inside the genius mind of Dr. David Berg and what he does and how he looks at it and how he can help your company, help your employees, help your staff have more certainty, more security, more freedom, free up expenses for your business to allow you to have a smart advantage. So we're not going to close the loop right now, by the way. We're going to open the loop right now. Why? Because when we come back, we're going to take a deeper dive with David. We're going to talk about some of the misconceptions in healthcare, some of the hidden costs. I'm going to talk about a walk through Genius Network's office at lunchtime, where he opened up this app and showed proof of how certain expenses that you probably aren't aware of were 10 to 1, and how you can save money immediately and help your team save money immediately. That and a whole lot more coming up with Dr. David Berg on growthtofreedom.com right after this. Thanks for listening to this episode of growthtofreedom.com. Are you struggling to get a steady flow of new clients every day, or maybe hit a plateau or hit a wall in growing your business? Well, let's help you solve this problem today. Let's review your business and have a conversation. You can do that for free today at breakthroughstrategycall.com. That's breakthroughstrategycall.com. In addition, if you're looking for a simple way to implement some of what we've been talking about in today's episode, then I want to encourage you to get our free small business toolkit. You can get that at activate.breakthrough3x.com. That's activate.breakthrough3x.com. If you'd like access to the special resources and all the show notes for this special episode, make sure to visit growthtofreedom.com. Welcome back to growthtofreedom.com. Now, by the way, I expect that you got a lot out of that first segment with Dr. David Berg and how he views the world in a different way. Yes, exponential growth can be gotten by, making moves to create 20% of the activity, create 80% more results. But what if you could do that in reverse and pull the things out that are just inefficient and also improve things up to 80%? Well, that's a lot of what you heard in the first segment of the episode. And by the way, you want to grab a piece of paper, you want to grab a pen, I encourage you to do that. If you want to come back to this episode, you can go to growthtofreedom.com/285. That's growthtofreedom.com/285. If you never want to miss an episode, go to growthtofreedom.com/subscribe. Now, David, I want to dive in. At the break, we were talking about, 5 dimensions. We were talking about, how you see, down the road, the vision of things, and yet being able to make it usable for everyday people. What do you think is the biggest thing holding most people up from, when you offer your healthcare? And I'll give one example. I don't know if you remember, this is probably, 4 or 5 years ago. We were walking, it was at a break at Genius Network, and I forget what even stimulated, but you and I were walking down the stairs at Genius Network in Joe's office, and you know how much of a freak show it is at Joe's office, and we come downstairs, we're in the lunch line, and you open up this app, and you start showing me prices, and I forget, maybe it was me and a couple other people. You started showing prices for something as simple as prescriptions, and you were showing how, like, literally everyday prescriptions, you zip through like 4 or 5 in a matter of seconds, but like there were a couple, like the normal price that like you could get them for like $4, and then the charge at most places, like and I won't mention names, but in normal everyday places that people will go pick up their prescription, be like $400 billing, up to 100 times cost, right? And thinking about like the average person, if the average person makes $15, 51% make $15 an hour, how can they afford a $400 prescription? I know my mom, God bless her, she's on like 8 or 9 different prescriptions, and my dad pays an exorbitant amount of money through the healthcare system. So speak to that one simple idea right there of like 100 times, and like the big misconception or fear that someone might have of making a shift or pivoting to something new, with especially that can save this amount of money.
Wow, you asked a lot of questions there. So let me address the one point is you hit on fear a few times.
Yep.
And I've been thinking a lot about this in the last 6 months or so, especially now you've got all the political stuff, the protesting that's going on right now. And I just, it seems to me that we've got a huge economy for fear.
Yes.
There's a lot of money being made in fear. There's a whole economy around fear.
Yep.
How do you stop that? Like, you can't just blame the media, right? They got an economy, they got a business, and they're selling what the market wants, and the market wants fear, I guess.
Right.
There's an economy around fear, and just know that as human beings, it's everywhere, every country. We must be wired for fear. We must be wired to look at fear. We must be wired to get fear relieved. You must be wired to create fear. I don't know, but it's everywhere. And there's a whole economy around it. And the same thing exists in healthcare. Same thing exists in the library business. Same thing exists in car mechanic business. It's just there. So how do you get in front of the economy of fear? I don't know. What I've done is I've said, hey, so let me put this out there. I never thought of this before until right now. I benefit from the economy of fear. I turn it into money every single day. But here's how I do it. I go to the marketplace and I go, hey, if you work for me versus anybody else, put your name in the hat with the other 10,000 people who want to work for me. I'm going to give you free healthcare, you and your entire family. Never have to think about it again. Please work for me. Right? So we get thousands of resumes every single month on that. So, and I benefit from that because I have the best of the best to pick from. Meaning that if somebody gets a job with me, they have beaten at least 100, if not 300-400 people for that one job position. Right? So it's easy to pick people that align with your values, that align with your strategy, with your vision. It's easy to run my company. All my companies are easy to run. And we've got our healthcare costs now. We just got 2019's numbers in, and we are probably about a fifth of what all the actuaries say we should have spent on a per person basis. A fifth. It's less than we paid in 2000, right? We didn't spend this little on healthcare, incredible benefits. It's not even believable what we're doing, but it's all, and so as much as we have eliminated the waste and the unnecessary spending, and we've created strategies to help our business, that fear's in there for people want to work for Redirect Health because they're afraid to work somewhere else. And we benefit from it. So that's what's happening at every hospital, every pharmacy on the corner, every insurance company, every political party. Right? So it's a matter of navigating that economy of fear and alleviating fear in some place and taking advantage of it. So that's the first thing that struck me, is I've been thinking a lot about that economy of fear, but I can't remember your other questions.
So the other thing that ties in, right, with this economy of fear, Dave, is, related to the move. You call it the move before the move.
The move before the winning move.
That's right. And like essentially everything we've been talking about, even what you just brought up about, how you look at a problem, right? How we all, I mean, at the end of the day in business, right? What do? We solve problems, right? And where there's pain and angst and fear, there's opportunity at the end of the day. And it's just how you choose to show up. Some people could say, and I'm going to say what I'm going to say, right? You can choose to endorse it or not based in the role you play in it. But some would say that the traditional healthcare system, which is outdated, in my personal opinion, doing best it probably can based on very old, outdated habits, rituals, patterns, right, is exploiting the average person, right, with what they do. So you recognized, as I view it, a hole in the market, a problem, and you're coming here and going, hey, there's a new, better way, right? And it's not understood, just like the Tucker automobile in the early days was not understood by the big three. And those big three tried to crush, the Tucker, which
that was a disturbing movie for me. I found that movie disturbing for me. I enjoyed it.
Here. And I'm sure probably for you, even dealing with the healthcare scenario is probably a lot more real than we have time to go into as well. And how, how big the game is and how big it gets played, that people just don't know unless they're on the front lines. But here you are offering a better new alternative that's healthy and saves business money and saves employees money, right? So talk about this idea of the move before the winning move, and how, like, we're kind of moving out of context of just direct healthcare and saying, we'll circle it back and make sure, as you're listening, like, would you like to, at the end of the day, would you like to save on your healthcare costs? Would you like to make things easier for your employee? Would you like you and your team to eliminate a lot of waste? In a few minutes, we're going to give you a way to how you can connect with David, his team, to learn more about how you can put this into action, how you can take this. But when you meet someone like David, who's transforming a multi-billion-dollar industry, right, literally, and he started grassroots. See, he isn't an insurance company first, so to speak. He was a healthcare company first that just looked at it and said, there's just so much waste here. How can we do this better for everybody, right? And out of that problem has come opportunity. So speak to this idea of the move before the winning move, and how all of us can better live in that space to, just operate more effectively, more efficiently, as you view it.
Okay. So the way I think about it is, in any business or any game or sport, there's a winning move. So in chess, the winning move is checkmate.
Yep.
So everyone's playing towards checkmate. Everybody's playing, and they might be playing towards, setting up the sequence for checkmate. And the better you are, the more sequences you can play, but it's going towards checkmate. That's where everyone's going. So it's there's a lot of competition for that move. There's a lot of competition, but maybe there's the way I like to frame the move before the winning move is that positioning that nobody is gearing towards. There's no competition for that position, but once you're in that position, you've got huge advantage because of your own unique abilities, your own relationships, your own whatever. So that position for me to have a huge advantage might be different than it is for you in the same game or in the same business or the same industry. So the move that most opponents, everyone knows what the winning move is. I won't go into that, though. The definition of the move before the winning move. Man, what's the idea that? Think of it this way: most opponents won't see it naturally, especially if they already have advantage through other experiences. They won't see that because it's more unique to you, and it's commonly dismissed by everybody else. It's just commonly dismissed, and so for instance, the move before the winning move is, well, let's separate the everyday care, the 90%, from the expensive stuff that everyone's afraid of. Like,
right.
Nobody's afraid of the cost of a primary care visit. Nobody's afraid of the cost of a $4 drug. We're all afraid of the cost of a $4,000 drug. We're all afraid of the cost of a $200,000 surgery that I've never seen, but I'm sure I'm told they exist, but I've never seen one. We're all afraid of that expensive stuff that's going to bankrupt us. But we let that fear then direct what we do for the 95% of the stuff we do. So the move before the winning move is let's separate the 95% from the fearful stuff. Right? Now, from that position, it's a lot easier to win. Nobody else is trying to do that.
Right.
And similarly, if everyone else is trying to lower healthcare costs, that's the winning move. Let's lower healthcare costs. That's a winning move. Everyone's going towards that.
Yep.
Everybody's fighting because you lower the healthcare costs for somebody, you lower somebody's revenue. Right? Every dollar you lowered somebody else's revenue. So you got this tension, this fighting. And you can think it's free market all day long, but the move before the winning move is, let me back. The person who wins that are the big hospital systems, the big insurance companies. If I'm a $300 billion annual revenue insurance company, you think little old me is going to be able to fight that game?
Nope.
I haven't got a chance, right? There's no chance I can beat a $300 billion company. And that's how big they are today. And they're all publicly traded. So they got like resources on resources on resources. They can lower costs and they will win that game at my expense all day long. So what's the move before the winning move that they can't play? Well, how about this? What if we eliminated unnecessary spending? Now they have no way. Now they don't have the fear. Now they don't have the risk. Now you don't need as much insurance. They couldn't even do this move if they wanted because their game depends on that fear and that risk and that cost. And they lowered enough so they have a benefit. But what they need more than the lowering of the cost of healthcare is they need the story that they're trying to lower it. The story they're trying to lower healthcare costs is way more valuable to their $300 billion business than actually lowering the cost.
Yes.
I'm not playing the game of lowering the cost. I'm playing the game of eliminating unnecessary spend, unnecessary administration, unnecessary copays, unnecessary. Because, what's the right price for an MRI you don't need, Dan?
It's too much. That's what.
Again, what's the right price? When you think about it, what's the right price for that MRI you don't need?
Any price is too much.
0 is the right price.
Yeah.
Yeah. All day long. The right price for the MRI, but you could pay $3,000 if you go to a hospital system. You could pay $300 if you do it effectively. You pay $300 all over the country. But we see people paying $3,000 all over the country too. So the fair price for an MRI is $300. But the right price for that MRI, if you don't need it, is 0.
That's right.
Now, when you think about it that way, that's the move before the winning move. Let's not try to reduce costs and even get the fair price. Let's figure how we can eliminate the need to get the fair price by eliminating the need for the MRI in the first place. And how do you do that? Well, maybe it's let's order a $25 X-ray, see what it shows, see if that shows us enough. If it doesn't show us enough, now let's move to the MRI next week or tomorrow. And by the way, when we do move there, let's only pay $300.
Right.
But the first move is not try to get it for $300. The first move is, can we get it for 0? Can we not? Can we not need it? Same with medication. The right price for a medication you don't need is 0. The fair price might be $2.15. The normal or rip-off price, if you go through your insurance thing, might be your $20 copay on a $2 drug. That's what I was showing you at Joe's place.
Yes.
Now, if you don't do it right and you've got a business that's got their self-insured company set up not well, maybe their consultant is not giving them good advice or giving them great advice for the consultant, but not for the business, that $2.12 drug that should cost $2.12, but is charged $20, now might be charged $200. But every player in healthcare right now understands how to laser focus on your business if you got that business that's allowing a $200 charge for that drug. And the industry will get $200 out of your employees because you don't even know what's happening. The transparency is not there. So the move before the winning move is that move that nobody else is looking at, that position that nobody else is looking at. So I just gave you two big ones. Let's separate the everyday care from the expensive stuff. Don't let the expensive stuff control it or even know what's going on. Put a brick wall there. You need them, but don't let them be at the center of it. Go use them when you need to. When I need their operating room, I'll go get it and I'll pay for it, the fair amount.
Yep.
When I don't need it, I'll pay the right amount, which is 0. Right?
That's right.
Fair amount and the right amount. The right amount's often zero. Fair amounts could be $2 or $300 or $30,000. What matters is get the right amount if it's zero first. And then a lot of cost just goes away. And also the complexity that's attached to it goes away. So those are some big moves before the winning move in healthcare.
Those are huge. Those are huge. And as you're listening, as you're watching right now, like, are you ready to make the move before the winning move? Right? Just one little move, whether you bucket your expenses into the catastrophic and everyday care, or set it up so that you're eliminating unnecessary costs and the preferred cost is zero when you don't need it, right?
Mm-hmm.
Why pay for it when you don't need it? How many of us have been paying for insurance that we don't really use or need? But then when we need it, we have it. What Dave and his solution gives you is the ability to cover yourself on both sides of the fence. It's almost like in stocks.
Now here's
yourself protected when it goes up, protected when it goes down. And that's what Dave's method gives you the ability to do.
Hey, so Dave, one other thing I want to just double click on is another move for the winning move it will not ingratiate me to some of my peers right now for saying this, but you cannot let doctors be in charge of healthcare. It won't work. Healthcare is such a complex system right now. We need system thinkers. We need system thinking, meaning that there's components, there's assets, there's process all over the place, and there's relationships and workarounds. There's so much stuff that's happening that it's about the entire system. It's not about a linear process at all.
Yep.
If we don't have system thinking in it, you're going to spend a lot of money and you're not going to get the care you need. And especially now around this is COVID era, just post, right? We're in the middle of it still. There's never been a time where system thinking was needed more and wasn't really applied. Right.
And I think that what you just said is so profound. Repeat it again. Don't let
what? So give me
don't let doctors.
Oh, don't let doctors. Yeah. Doctors do not have the capability to do the system thinking that's required today. That's different than what was required 10 years ago.
Yep.
You didn't need system thinking 10 years ago. So it made sense for doctors to have a lot more control over what's happening. Today, they don't have it. They weren't trained for it. They weren't selected for it to go through their training. System thinkers do not go through healthcare training, do not go through medical training, because medical training is about you do this, then you do this, and don't make a mistake, and right. But let me just kind of what I explained system thinking a little bit more, and I'll use the analogy of a spider web, if I can. And I want to get off of healthcare so it can be applied everywhere. If I keep it on healthcare, people tend to go, well, it's just healthcare and it's just Dave. I'll apply to a spider web. So it can go anywhere, this thought that I want to get out there. A spider web is a system. It's a system to serve the spider, and it's a system to specifically make sure the spider gets fed.
Right.
Correct?
Yep.
The whole system. Now, in that system, there's process that starts all the way at the level of the DNA in the spider has to through the RNA, has to create the right proteins that have to be put into the spider web to make the spider web work, make it sticky, make it strong, all the stuff it needs to do.
Yep.
But there's a whole system around just that. But also at the other end, the spider has to eat it. So it means that the DNA has to create the right proteins in the saliva or whatever spiders have to be able to digest the bug it creates. Plus, there's also a process for wrapping up the spider. There's a process for figuring out where to put the web so that it can tolerate the wind of the day, right? It doesn't end all the things that go into this system for feeding the spider, the who and the purpose and the who.
Yep.
Purpose is feeding, the who is the spider. Healthcare is the same thing. So let's go back to spider web. So any one of those strands, if they broke, spider web's great, but enough break, it collapses.
Yep.
And that spider doesn't eat anymore until it restarts. It collapses, it implodes. So what does that spider do? Does that spider walk around and see a spot on the spider web that's getting a little weak or even is broken and say, well, I don't think this one's going to matter, so I'm just going to leave it and move on to the next. And then move on to the next, move on until they see like something that appears catastrophic. In a normal system, You can do that because you can measure it and you can do the likelihood. When you get a very complex system, you cannot tell, that spider cannot tell which break needs to be fixed and which ones don't. So they eliminate the need to make that evaluation. The move before the winning move for the spider in their complex system is, I'm not going to make the evaluation of whether it needs to be fixed. I'm just going to fix all of them. I'm just going to fix them all when they're small. I'm going to fix them all when they're big. I'm going to, right there. And by doing that, that complex system is continually being repaired. And every time something happens, they have a repair, this spider's going to learn from it. Oh, maybe it was in the wrong spot and the wind caught it, or right, whatever. But any complex system needs to continually have that continual fixing and learning and cascading of the knowledge around it, because you cannot predict adequately enough in a complex enough system what needs to be fixed, what doesn't, and what's going to break it. So the thing that makes that complex system work, yes, it's the design. Yes, it's the actual building of it. Yes, it's the actual maintaining of it. But really, it's about the principle of how complex systems work. And there's all kinds of system theory in this. I'm not making this up, right? This is out there. This is not Dave Berg's way of thinking about stuff. This is just something I like looking at, because I see the healthcare system as a very complex system. And we created our own system, made sure the philosophy made sense. But what makes it work is that we are fixing those little breaks every minute of every day, not knowing which ones mattered. At the same time, we're sitting back and slowing down the world and going, where's that domino that if I remove it? So think about those little tiny fixes in healthcare are part of what we do every single day. And when I even try to describe it to people inside my organization, how important these little fixes are, these 100 fixes a day, they don't see it. It's such a winning move before the winning move that even the people benefiting from it do not see the value of this. And it's much easier to get people to fix these little tiny things and to hire people to fix these little things than it is to convince somebody to be a great healthcare consumer. When I started in 2008, I started for about 3 years. I was just trying to pound in, make all my people, our employees and my friends' employees, great healthcare consumers. What a losing game that is. That's what that was the winning move, everyone said. The move before the winning move was, let's eliminate the need for anybody to become or be a great healthcare consumer. Let's just create a do it for you model. Yep. And what we discovered is we can do it for you at about 1/10 of the cost as I can train you to do it yourself. Why would you? And you don't want to do it. It's irritating, annoying to do it on your own. So that was a big move for us, probably about 2011 is when we said, nope, no more training people how to do it. We're going to do it for you, or we're not going to do it.
That's right.
And the cost just plummeted when we did that.
10%. Think about that as you're listening or watching right now. But if you can eliminate your costs on healthcare or healthcare related services by 90%, right? And literally the cost would only be 10% of what you're doing now. How would that shift the game for you? And even if it's half, 50%, 60% less compared to 90% less, I mean, how would that transform your business, put more money in your business, and allow you to do what David's done, hire employees, full healthcare benefits paid and free to them and their families, and have a waiting list of the best talent in your area and the world potentially wanting to work for you. David, I mean, you've given us so much. And, one thing I leave as you're listening right now, as you're watching right now from David, I've got multiple pages of notes here. The last idea is innovate your spider web. Always be innovating your spider web. Otherwise, it just might implode. It just might collapse. And we see this around us every single day. There's those companies who stay innovating. An irritated oyster becomes a pearl, right? If you stay on top of your game and always look at how can you make this spider web, your business, your team better every single day. Where can people go, Dave, to learn more about you, what you're up to, how you can help them get all these savings put in place in their business, or to get access to learning how your healthcare model can work for their company?
The first place is go to redirecthealth.com, just like it sounds. My email address is david.berg, B-E-R-G, like iceberg, at redirecthealth.com. That's the easiest place to start. And then everybody's got slightly different needs. And we've got some stuff on there for individuals. We've got some stuff in there for small businesses. Also now for large self-insured companies. We got a lot of those folks coming to us now. the word's out there that you don't have to spend the kind of money that you're spending before. So that's new. I mean, that's not new, or that's new knowledge today that didn't exist 5 years ago.
Right.
5 years ago, there were a lot more companies and people and CEOs, founders of companies that were saying, I just got to do it. It's a necessary evil. Check the box, hand it off to somebody else. What we're seeing now is CEOs are not doing that. Just even big organizations, huge organizations are going, no, this is the CEO's job. This is too big a line item now. And I suspect I'd love to listen to some of the conversations between the HR managers and CFOs who used to do this, and now the CEO's taking it back. I took it back in 2007. I said, no, I'm in charge of healthcare now in our company because this is going the wrong way and the math doesn't work.
Yeah, I mean, as you think about your profit and loss statements, your balance sheets, chances are payroll is one of your highest expenses, if not the highest.
It is.
Behind that is your medical care. Well, what if you could eliminate the waste to create an exponential return, attract the best, keep the best? I mean, is retaining good talent important to you? Would you like to be the only company they would want to work for, short-term and long-term, because you have applied the smart advantage? I encourage you, if you're looking for a smarter, better way, a new way to re-engineer your healthcare model to save you money. At the end of the day, bottom line, you're going to save money in your business in most cases.
Hey, Dan,
right? I'll put an asterisk there.
One of the things we do with all our clients too is we make sure that they're not just looking at their healthcare. Most businesses look at their healthcare costs as just the premium they pay every month, their portion of it. They don't look at their employees' portion of it. They don't look at the out-of-pockets for co-pays and deductibles. They don't even know what they are. What we encourage them to do is, and some companies say, well, I don't offer healthcare, so I have no cost. Look at me, aren't I great? Well, then it's so easy to look at their workers' comp costs that are now higher because they don't have healthcare.
Yep.
Their recruiting costs are higher because they don't have a value proposition that is different, that differentiates them. They can't keep, it's easy for their competitors to poach their employees, so their retention costs and turnover costs are high. And their people, when they have to see doctors, have to miss work, so their absenteeism is high. So we've created a tool for our clients where we help them quantify their healthcare costs, theirs and their employees, their absenteeism costs, their workers' comp costs, their turnover costs, their retention costs. And we said, let's look at this in a rolling 5-year forward so that we can hold ourselves accountable to lowering all these costs. I love it when we do that with business owners because that's when $50,000 savings in healthcare can turn into a $500,000 savings right to the bottom line. And then we help them measure it going forward. If I could be only in that business, I would. That's the most fun part about my work is working with the companies in that 5-year forward and just getting them to think about healthcare not as an expense, but as a means to lower the other costs in their business. Recruiting, retention, workers' comp, absenteeism, greater than the cost of the healthcare they just gave to their employees for free. And I mean, that's the strategy that excites me the most right now. We're doing a lot of that.
And if you want to turn healthcare into an exponential outcome for you in all these areas David just mentioned, it's real easy. Go check out what they're doing at redirecthealth.com. That's redirecthealth.com. You want to connect with David personally? Reach out to him at david.berg@redirecthealth.com. That's david.berg@redirecthealth.com. By the way, we'll have all the notes, all the links, all the resources we talked about in the show notes for today's episode. You can come back to this episode at growthtofreedom.com/285. That's growthtofreedom.com/285. David, what is, as we leave this, what action steps would you encourage our viewers, our listeners to take as a result of our time today?
Action step. I would, man, I hate thinking about action first. Can I talk about, I want them thinking about something. I want them just thinking.
That's an action step.
Okay, there you go. I want them not acting. Just slow down and just think for yourself. And so often what we do as business owners is we want to think about the widget we're creating or the service we're doing. And we think that's what we do. That's what we should be doing. That's what we love doing. That's why we're doing business. Just back up a little bit and just think about something, a move before that can help that widget factory or that service that you want to provide. And just think for yourself. It's so easy to hand stuff off to experts. The challenge in healthcare, but also other places, is the experts are not aligned with business owners financially. The incentives aren't aligned. But it doesn't mean we don't need experts. But let's use experts for their knowledge, but not for their thinking. Make the decision yourself. Use the experts for the knowledge, for their opinions. Use multiple experts for their knowledge and their opinion. It might be the same knowledge, same opinion, but then make the decision yourself. And my experience has been that if somebody can figure out a relatively complex system of a business, you can figure this part out as soon as you choose to let this be part of the process of running your business, is fixing every little spiderweb break you see. Just go fix it. This is one of them. You cannot trust the experts in healthcare and many other places, in the vendors of your business, to think for you, to decide for you. Don't do it. Do not trust them. You can think, every entrepreneur I've met can outthink any of the vendors or the brokers, the insurance companies, if they chose to do it.
Yep.
Just do it. There's a huge benefit in just figuring it, to make it make sense yourself.
There you have it. He's David Berg. I encourage you, go check out what David is doing. Go to redirecthealth.com. If you want to connect with David, david.berg at redirecthealth.com. I encourage you, you can go find his book. This is the original version, Fighting Healthcare, Making Healthcare a Smart Advantage for Your Business. Find a way to get your hands on this. Some amazing info, including his health plan scorecard, which is an amazing tool and resource. I believe you're on volume 3 now. Is that right? Coming up on volume 3?
So I would encourage people to, if they would like to see the version 2, to reach out to me, and I'll make sure somebody sends you the link to it. It might be off the new website, because there is a version 3 coming out soon. And I'm toying with, do I want a version 3 or do I want a new version 1? And it's because I'm at a transition myself where I don't like the concept of fighting anymore, because we solved it. There's no fight. The fight is over. Like I don't want to have Fighting Healthcare as a title of what I'm doing today, because the fight is over.
Yep.
It is over. We don't fight anymore because we know the pathway to victory every time. We can predict it every time. There's no fight. Now, a lot of people are fighting because they don't know it. But so I'm toying with a new version 1 that I don't know the title, but it won't have the word fight in it, because who wants to be invited to a fight?
That's right.
I would invite you to not have to fight, Dan.
Well, guess what? You don't have to fight for your health care.
The fight's been won. Just
that's right.
House and we'll watch the results. Right? You don't have to fight anymore. Now, there's a lot of folks out there still trying to fight, and that's that fear economy. And I've been part of it many times, and I'm part of it today. And it's hard not to be part of the fear economy. But I don't want to be part of the fear economy. And fighting is a fear word. Right? Why would you fight if you didn't have something to fight against? And there's fear. So Dave Berg's new thinking is around, let's stop fighting. It's over. Let's eliminate.
That's right. So I'm going to rewrite David's title right now. It's called Your Champion in Healthcare. That's Redirect Health.
Or
the back in healthcare. Go to redirecthealth.com. Hook up with David. He and their company can definitely help you look at how you can save in all these areas he's talked about today. David, it's been a pleasure to have you on the show. Finally, we've been talking about this for a couple of years, so I'm glad we were able to finally connect, my friend.
My pleasure. Thank you.
So I want to encourage you, take the next step with what David shared. Instead of taking like massive action and running into a wall somewhere, why don't you just stop and think and realize you can get control of your healthcare. You probably have the power to make better decisions than a lot of these vendors, partners that you've been led to believe are your experts. Rather, what if you took a different approach? And what if you actually reached out to Dave's company to see like some of the surprising hidden costs that you could save, not only you, but your team, your employees, your vendors, your partners even, and get this new model into people's hands all over the world. Go to redirecthealth.com. That's redirecthealth.com. If you want to reach out to David, go to david.berg at Redirect Health. Thanks for listening. If you want to come back to this episode, you can go to growthtofreedom.com/285. That's growthtofreedom.com/285. You never want to miss an episode. Go to growthtofreedom.com/subscribe. That's growthtofreedom.com/subscribe. We'll see you next time on growthtofreedom.com. Thanks for listening to this episode of growthtofreedom.com. Are you struggling to get a steady flow of new clients every day, or maybe hit a plateau or hit a wall in growing your business? Well, let's help you solve this problem today. Let's review your business and have a conversation. You can do that for free today at breakthroughstrategycall.com. That's strategycall.com. In addition, if you're looking for a simple way to implement some of what we've been talking about in today's episode, then I want to encourage you to get our free small business toolkit. You can get that at activate.breakthrough3x.com. That's activate.breakthrough3x.com. If you'd like access to the special resources and all the show notes for this special episode, make sure to visit growthtofreedom.com.